So today we're going to be going through a shockwave treatment for lateral epicondylitis, or most commonly known as tennis elbow. So our patient here has kind of exhausted all conservative options. She's had active release technique, Graston technique, other massage modalities, as well as traditional physical therapy, and she's still in quite a bit of pain. So she's been wearing a brace and trying to limit her activity. She does want to get back to playing tennis. So we want to try the shockwave therapy to see if that will help stimulate more of a healing response and get her back on the tennis court. So with Shockwave sends acoustic waves into the tissue. So basically that means it's going to send some powerful sound waves into the injured site. And those sound waves, what they found is that it will stimulate a cellular response around the injured area to promote increased capillary production. It's going to wipe out neurotransmitters that elicit pain responses. And it will also break down myofascial trigger points and tension in the muscle that can be pulling on the site that's causing pain. So for tennis elbow, we're going to be working a lot on breaking down the trigger points and the tightness in the extensor muscles of the forearm that are pulling into the common extensor tendon of the elbow. And then we're going to change the head out into a more focused projection right at the painful site to try to eliminate that chronic inflammation in the area and break down some of the adhesions around the actual insertion site. I'm gonna do a couple just orthopedic tests just to kind of see where we're at in terms of pain level today. So go ahead and hold out your hand like this, and I'm gonna press down your middle finger, and I want you to resist. And how's that feeling up there? Hurts? All right, and pain level, how would you say in terms of pain, 0 out of 10, what would you give that? 4. Okay, now I want you to make a fist for me. Now don't let me press down your fist. And painful there? More sick, so a little bit more pain, a little bit more muscle recruitment through there. And then go ahead and relax the whole arm here. I'm gonna do a little bit of palpation right up into the epicondyle of the arm. And how is that as I press in there? Quite painful, and put a number on that one too. 7, okay. So now we're gonna start the shockwave treatment. We're gonna use a little bit of ultrasound gel. Ready? How's that feeling so far? Okay. So now we're checking the counter there. We want to see how many shocks are going into the tissues, how much energy is going. And now as we're doing the treatment, is this pretty tolerable so far? Is it causing any pain at all? A little bit of tightness, okay. And move that around a little bit. How's it feel so far?
Yeah, it feels good.
Let's just hold your hand out like that, and then I'm gonna push this down. How's that feel?
That's crazy.
Pain level?
Like nothing.
Hold a fist like this. Don't let me press it down. How's that?
It's tiny.
Tiny?
Yeah.
Okay. Now we're swapping out into a much more focused head on the unit. Okay, you ready?
Yep.
Okay.
Yeah, totally fine. Yeah,
That hurts?
yeah, it's not too bad.
Tolerable?
Yeah.
Okay. Still okay? And you're good.
Okay.
Let's hold the hand out again. So don't let me press this down. How's that feel?
No pain.
Make a fist.
No pain.
And you felt stronger that time. All right. So that was a protocol that we'll use for tennis elbow lateral epicondylitis. Again, addressing the extensor muscle tension, myofascial adhesions, trigger points, and then we're going to address the tendon and the attachment point at the bone to help the patients with pain.